Glenn Bruce, Executive Director of Medical Services, Murrumbidgee Local Health District. Everyone happy?
Yep.
Good. All right. Good morning, everyone. Welcome to the COVID-19 update for the Murrumbidgee Local Health District. This morning, we will be reporting another positive case for Wagga Wagga, and the person in question is a member of the Kildare Catholic College community, and that was reported yesterday. All casual and close contacts have been contacted by the school, and they have been provided with advice about testing and isolating as is required. There is approximately 90 close contacts and 100 casual contacts, and they're all in isolation. The Murrumbidgee Local Health District is currently working with the Public Health Unit to conduct contact tracing and to identify the source. And currently our belief is that the source came from outside of the region. So we don't have any evidence that this case is a sign of community transmission in Wagga Wagga. So far, we've had no additional positive results from 665 tests. So since the outbreak of COVID-19, then it has been 104 cases in the Murrumbidgee Local Health District. Sadly, we've had 2 patients who've passed away. With the current outbreak, there has been 43 cases, including the case reported this morning. Of those patients, 17 are being cared for by our KITH service, the care in the community. And 3 patients are currently admitted to Wagga Base Hospital, none of whom are in intensive care. As part of the case that's announced today, there is one more venue of concern, and I'll just make sure that I get it right. So it's the Best Street Cafe between 8:45 a.m. and 10 a.m. on Thursday, the 30th of September. So this is currently is seen as a casual contact. So if you've been to that venue on that day during those hours, please go and have a COVID test and isolate until your negative result comes back. If your test comes back positive, you'll be contacted by Public Health and you will be provided further information. So what I'll do now is I'll ask Emma Field to come and talk a little bit about vaccination in the district, and then we'll be happy to take some questions. Emma.
Okay, so probably a really good time to be thinking about vaccination and where we are here currently in Wagga and the Murrumbidgee. So the latest stats that we have overall, first dose completions for vaccination is 73.2%. and second dose is 50.3%. So that's this week's data. For Wagga in particular, it's 87.4% first dose and 60.5% for second dose. So we're really urging anyone at this point in time, given we've had this exposure in Wagga and at Deniliquin, we've had some recent exposures there. If you're thinking about vaccination, please come forward and get vaccinated. We have made our vaccination clinics at Wagga and at Griffith walk-in. There is no need for registration today and over the weekend. Please come forward for vaccination. We're heading towards a milestone of 50,000 jabs in Murrumbidgee. That's a total that we have since we've began, which is an enormous amount of vaccine. And I think this is particularly concerning, yes, the current outbreak, the current cases, and that's why the best defence we've got at this point in time is vaccination. In terms of testing, I just want to remind people that the testing that we have across the district is today at Wagga. We have 2 venues that Murrumbidgee has operation, which is at Murray Street, which is between the hours of 9 and 4. But then we also have the drive-through at the Equex Centre between 10 a.m. and 6 p.m. We also have our GPRC at Glenrock, and we also have our Lavity drive-through. Deniliquin has also got testing available between 9 and 1 today, and we'll be operating all over the weekend in Deniliquin. So we're urging anyone who has been identified as a casual or a close contact to please come forward for testing. not only that, anyone that, even if they've got the mildest of symptom, although they're concerned that they've been to one of those exposure sites, please come forward for testing.
Some questions
Yeah.
for Len, probably.
Yep, sure.
So Len, you mentioned that it's someone from the children's community. Do we know if
Yes.
that's a student or a teacher or other staff member yet?
At this stage, we're not allowed to provide more information, but the people at school will have the details of their exposure.
And you said it wasn't from a community transmission. Does that mean that it is a local still and they've travelled outside and brought it back, or?
With the information that we've got is we believe that the source of this infection was from a non-resident from Wagga Wagga.
But they are still in Wagga at the moment isolating? Or?
No, the source of the infection is not in Wagga Wagga at the moment.
So you said there was another case today as well. Was that from the school also? Was it a family member?
No, the case from today is the case that was released yesterday, but because we just added to today's numbers because of timing.
So the case is a Wagga resident, but the source of where they caught the infection was outside the LGA, is that what?
That is correct,
Okay.
yes.
And with all these close and casual contacts, do we know when we'll be seeing those test results come back?
So we've received some of the test results back that have been negative, but because the exposure was quite early in the disease process, the casual contacts will actually require a second test in a number of days, and they've all been provided with that information. So really it's a watch and wait, and we know that people can still return positive results up to 14 days. With Delta, it seems as if the majority of people test positive earlier. But it really is important, if you've been identified as a casual or a close contact, you need to be very, very meticulous for the mildest of symptoms even later on in the disease process.
Obviously, a case in a school is quite risky as well. We've seen in the past it often has led to outbreaks. Are you surprised at all that there haven't been any more positive results yet after so many tests?
It's still very early. It's not likely that the contacts would test positive in 1 or 2 days. So we would really have to watch this space and see what happens with further testing this week. Once again, any venue where people are in close proximity, there is a risk of transmission, and that's why we've had the measures in place. But I think it's really, really important that vaccination makes a massive difference. So it reduces transmission by 50%, which is really great. And once again, apart from reducing transmission, it also means that people who do become infected are far less likely to develop serious illness, which is really the aim of the vaccinations against COVID.
Just to clarify as well, sorry, I'm getting my wires crossed. The case at Kildare, are they isolating in Wagga?
Yes, they are. Yes, they are.
And the 600 odd tests you mentioned before, was that all conducted since this case was announced yesterday?
I just need to double check with Emma. Yeah, so they were all. So that's a massive response for people to get through 600 tests. So once again, the community has supported us as they've done, for the last 18 months.
Now, with these vaccination clinics, you said that from tomorrow there will be no bookings needed. Why have we decided now to come to that decision of no bookings?
What we're really trying to do is to encourage the hesitant minority and to make it easy for people just to come in and get a vaccination done. I think it really is important that we're obviously very excited that New South Wales has reached 70%. We're not quite there for Murrumbidgee, so we still have some work to do. But if you're not vaccinated, your risk is the same. The fact that the other 80% of people will be vaccinated, then you may be less likely to be infected by them. But if you become infected, your risk of developing severe illness and dying is the same. I cannot encourage people strongly enough. Go and get vaccinated. If you're unsure, talk to your GP, go to the vaccination clinic. There would be staff who can give you advice. Go to your pharmacy. Please go out and get vaccinated. Because what we really want is we want everyone who's eligible to be vaccinated as quickly as possible.
We've been told in the expect Wagga will go back into a lockdown at all?
We'll have to wait for the advice from the public health unit, but we know that our response to COVID cases is changing as we have a larger proportion of the community vaccinated. So we'll wait for the advice from the public health unit. But because we believe this is not a case due to community transmission in the area, the risk would be lower than, once again, if it was multiple cases linked to a source in Wagga.
And there's word going around this morning that from Monday, people from metropolitan areas will be allowed to come and visit the regional areas just on a day trip. As you said, our vaccination rates aren't as high as those other areas, so are you worried if people from metropolitan areas will be coming into the region?
We're obviously concerned for anyone visiting us from areas where there's high risk of community transmission. But even in the metropolitan areas, the case numbers are decreasing quite significantly. And we see that through the daily case numbers, the numbers of hospitalizations, the number of patients in intensive care, and even the number of patients being ventilated. I think it is important, though, that we still do those things that kept us safe for the last 18 months. I think wearing your mask, practicing hand hygiene, don't go out when you're unwell, will do a lot in keeping us safe. Because you'll be aware that we've had a number of potential cases of community transmission in the Murrumbidgee, and we've really not had any cases due to those. And I think it's a testament to the fact that things like mask wearing, social distancing actually makes a difference. So I think it's more important for us to do that, and remember what we can do is to protect ourselves by getting vaccinated.
We are so used to having no cases here, but when the whole state opens up, they say we will see an influx of case numbers. So just how are you preparing for that, and what is our new normal going to look like with cases in the Murrumbidgee?
Well, we're expecting that we will have cases. There's a lot of preparation going on to care for these patients. What has been reassuring is that the hospitalisation rate for the Delta outbreak in New South Wales has gone down from about 8%, which was the highest, to less than 1.5% today. So we know that people who are vaccinated are less likely to become unwell. There is also more availability of sotrovimab, the intravenous drug that you can use for patients at risk of severe COVID, and there's very exciting news about an oral agent that's becoming available. So I think it will be different, and I cannot predict, but it's clearly with the use of vaccination, it's less severe illness, which will mean that the health service will not be overwhelmed.
Are you able to tell us if the case at the moment in Wagga has been vaccinated at all?
I unfortunately don't have that information, sorry.
How are they doing?
Well, they're at home, they're isolating at home, but I don't have any other further clinical details.
Do you have any further details about where the original transmission could have occurred?
No, we're still waiting for the public health unit to provide that information for us, because we want to be absolutely sure before we provide information. We don't want to speculate and then provide the wrong information.
And is the health district anticipating any more exposure sites attached to this case, or any potential cases that might be diagnosed in the coming days?
We will, in terms of the exposure sites, we'll wait for the public health unit to conduct their contact tracing. They'll provide us with that information. Very difficult to speculate about case numbers. What I'll say is that I'll hope for the best and hope that there isn't any more cases.
Just in terms of when this influx of cases does come, you say the Murrumbidgee is ready, that there's 30 beds in the COVID ward here in Wagga, but the Murrumbidgee Local Health District does have quite a large population of
We do.
242,000.
Yeah.
Just, is that enough beds, and is there enough care to go around for if there is a large increase in numbers?
So we'll obviously have a graded response, and even though there's 30 beds in the COVID ward, there's obviously lots of other beds in the hospital. We also have access to beds in the new development, And once again, we also have access to beds in other facilities in the district. We will also be able to access beds in the private facilities. So there's actually quite a large number of beds available. And really what we've been doing for the last 18 months is to plan how we would respond if case numbers increase. Probably the largest part of our work currently is looking at how we're going to continue all the other care we provide in addition to COVID when cases do arise. And we are, very confident that we can continue to care for, for people in the community. We've been able to continue elective surgery without any disruptions, which is obviously great news for the community and also for us. So I'm quite confident that we'll be able to manage with the help of the community if case numbers increase.
Yeah. So you're not worried that any other forms of healthcare will be impacted by COVID in the area?
It's difficult to speculate. It would depend on, the number of cases we have and also where the outbreak occurs in terms of how well the patients are. But our aim would be to minimise the impact on other healthcare as much as possible. It's impossible to give any guarantees at this time, but we've been managed to continue our business as usual, relatively unrestricted so far.
We got a few calls yesterday just from concerned parents and grandparents of students at the school.
Yeah.
One lady was saying her grandkid has come home and she's obviously elderly. They have a newborn sibling as well. Should those sort of family members at risk be concerned at all, or just sort of go about as normal so they feel more?
So all the members of the school community has been provided with advice. Obviously, if you're a close contact, you have to isolate, and then you should not have contact, with other members of the community, especially if they're not vaccinated. If you deem to be a casual contact, there's a different set of instructions, but it also requires some form of isolation. And if you're a no-contact person, it's really just important to watch for symptoms.
Have testing and vaccination rates increased in or around Deniliquin since the announcement that the woman in her 70s died?
Testing has definitely increased because as part of an outbreak there's an increased testing focus. I don't know exactly what the vaccination rates are. Emma may be able to provide advice if there's an increase in vaccination rates. Emma?
So in the Edward River LGA, which you may have seen, there was lower rates across the district. In the data that's come out, and it's just come out this morning that I've seen, but we did see an increase. I can get that for you later, but it was an increase in the first doses and second doses. I think it's important to note with the Edward River LGA, they've got a number of vaccination options for them, which is great. The Murrumbidgee has a clinic out there every 3 weeks, and they do in excess of between 500 and 600 vaccines a week. They've got a very big GPRC, so a respiratory clinic out there. But again, it's a big catchment area too, which incorporates a number of other smaller areas that, it's the tyranny of distance and travelling. But we have seen a good increase there. Certainly testing has been incredibly well received down there. And I know yesterday there was over 190 tests just in one day at Deniliquin. And we've seen that pretty much daily in Deniliquin, and so we would be encouraging everyone in that Deniliquin area, considering there is still those cases coming through, that we would really want people to come forward for testing, and it is there daily for that reason. Yeah.
Testing rates been consistently about 190 per day?
Up and down, up between, definitely over that 100 mark in the last 5 days, 5 to 6 days since we've had the announcement. And they weren't that high up until then. So obviously, having that amount of cases in the area, which is something we would normally see, is an increase in testing. I think it's important that we have that testing available in that community daily, because we know that close, as Len has explained, the testing regime for close and casual contacts continues, and whilst we have people there, we need to provide that.
And in the border region, has there been any increase in the vaccination rate in Albury at all since the road map changes were announced?
Yeah, I'm not quite sure about that one. I don't know about Albury, although I do know that we are, working with the Albury team down there to deliver some vaccine. We're doing a outreach clinic to the Albury Westside Community Hall next week, the 12th and 13th. So we're certainly, interested in helping where we can and to ensure that vaccination rates are high.
I'm now going to introduce our local member, Dr. Joe McGurr. He will also provide an update and take some questions. Thank you very much.
Thank you. Good morning. Let me start by saying that I understand that this news of a case in the Kildare school community will be a concern, of course, to that community and, of course, to the wider community. And I understand that will create some anxiety. We have been lucky in this region so far. We've been essentially free of cases, which has been great. But of course, as I've been saying, as the Health District has been saying, we're only one case away from cases. And of course, this has happened. Something from outside the region has brought this in, of course. So I understand that there'll be some anxiety about the situation that we're facing. However, there are a number of things that we can look to that are positive. First of all, the community here in Wagga has responded in terms of vaccination superbly. So I understand more than 87% have had a first dose, which is fantastic, and more than 60% are double dosed. So that's in Wagga. So that's a great protection. That means that the spread will be reduced. It means that the impact of the infection will be reduced. So that's great. In my view, the community has been really good about complying with restrictions and so on. They've been very careful. There's been a high level of concern, and so people have been good about not mixing in appropriately and respecting limits and so on its social interaction. So that's been fantastic. And finally, the local health district has moved into action very quickly. They have been preparing for this, of course. They've moved in. They've done the contact tracing, or in the process of following that up. They've identified venues. Will continue to identify venues. They will get the testing done. We've had more than 650 tests and no positives yet. So, of course, that may change. I understand that. But what we need to do now is recognise that this is something that was going to happen. It has now happened. The health district is responding. We need to respond, and that means we need to continue to get tested. If you're signs and symptoms, please get tested. Close casual contact, please get tested. Well done to those who've been tested. Please remember mask wearing, social distancing, all the restrictions that are in place. And please, if you haven't been vaccinated, please step up. Now is the time to get vaccinated to protect our community. That's what we're on about here, protecting our community. So look, I'm very confident that we're doing what we can here to control this situation. I understand that people will be anxious about it, of course, but we just need to now, okay, it's happened. Are we doing what we can? Yes. Can we all continue to do what we need to do? Yes. And I think that's in place. And so I'll certainly be keeping a very close eye, as I know all of the community will be. But the health district has been very active and very transparent about the information that they're sharing. And I'm very confident that we can control this situation and ensure the safety of the community.
Have you heard any word about a potential lockdown in Wagga at all, or what things will look like for the community past Monday?
Well, I think that will all depend on the results of follow-up testing and whether there are any more cases. Look, best case scenario would be that we don't have any further cases. And I think in that situation, we could confidently say things will continue. But the reality is that as tests are conducted and further contacts are identified and tested, that we could have additional cases. And in that situation, we would have to consider a lockdown, of course. I'm very concerned that Monday is not seen as Freedom Day. Monday is a step in a roadmap of opening across the state. I've previously indicated to the government my concerns about opening up of regional travel, for example. They have acted on that. They have held back travel from Sydney till we reach the 80% mark across the state. Now, I understand there's been some confusion about that today. Just before coming here, I was at a meeting with the Premier and I raised that issue with him directly, and I said it is extremely important that our regions are protected. They do not have the vaccination rates that you have in the city, and the travel should not open up till we reach 80%. And I understand that's their position. I do understand that from Monday there'll be inter-regional travel allowed, but not travel from Sydney, except for certain specified reasons which are already in place. And I think that's the setting should stay. It's very clear that the regions are not at the same levels as Sydney in terms of vaccination. And as I say, to your original point, Monday is a day where there'll be some relaxations. The government's decided to have a roadmap, so that we will move out of the restrictions that were in place. It is not time for a free-for-all. And look, if anything, this case illustrates just how vulnerable any community in the state is to the impact of this virus. And we've got a good situation here in that we've got a community that's done the right thing, got high vaccination rates, and a health service that's moving in quickly and effectively, which is great. Let's not compromise that further by opening up too soon. That's my message. And as I said, I raised that directly with the Premier this morning, and he certainly took that on board.
So is that clarification then that people from metropolitan areas will not be allowed to travel?
That is my understanding. That is my understanding of the clarification. And I certainly asked the Premier to make sure that was clarified. There was clearly some confusion in some postings and media this morning, and because of that I had the opportunity to raise that with the Premier. I felt it was really important that was clarified. All good? Good, perfect, thank you. Cheers.